Namaskar, I am Upasana Arora, Director Yashoda Super Specialty Hospital, Kaushambi. I am working in healthcare from last 22 years, and Yashoda Hospital is from 1990. But if you see, when I started working, that time there was no accreditation in industry, and we were facing only this kind of problem because we always wanted to give safe healthcare to our patients, as well as we wanted to make our place safe for our doctors and staff. But there were lots of guidelines for clinical safety and protocols. But if you see, there was no protocol that how to give safe medication to a patient or create a safe atmosphere in a hospital. So when I was working, everybody was doing things according to their experiences, previous experiences. Doctors were writing in their own way, nurses were doing their own way. So we were very successful doing things. But still you see, when there is no guidelines and there is no written protocols for anything, then you cannot make your hospital in a uniform way of working for everyone. So when this NABH came into picture in 2005, but I came to know about this in 2008. When I was attending a conference where Dr. Aarti Verma was taking a session and she was talking about Code Blue. And I was really impressed with the concept that if Code Blue is announced in a hospital and how people are reaching to a patient and we can save a life then and there only. This was an eye-opener for me, and I approached her and I asked her, how can you help me? She suggested go for NABH and everything will happen. So I started preparing for this thing, and that time we were not even very much aware about how to go. So we have taken help from some company. But if you ask me, just after our pre-assessment, we were so involved with the NABH guidebook that after that, from that day to this day, we are not facing any, difficulty to implement our additions, because every time addition is changing. Like right now, we are working on 5th edition of NABH, and every time, I must say that accreditation is very good, not only for patient, it is good for whole healthcare system, for the doctors, for the nurses, for all staff, as well as management also. So NABH has changed my whole life 360. It has changed me, my way of thinking, my way of working. And what happened, one of the girl who was coming from that company, I was going with her to visit that biomedical waste facility. So we were sitting in a car and we were just discussing about how to go further. She told me, madam, why you are depending on us only? Why don't you read this book? And I thought, yes, she is right. When I am going to see facilities and I am involved in everything, so why I should not go through all the book? And that was the time when I was just reading that book like it's a Gita for me. And one day I called all my staff and I just talked to them. I told everyone, just read this book thoroughly as it is your Gita, Quran or Bible. So those days we were talking like this, eat NABH, sleep NABH, drink NABH. So everybody was just passionate about NABH. And that is how I got my accreditation in 2010. And this hospital was the first accredited hospital in this area. And my team is still same. We are working together from that time. And everybody is so passionate about NABH because now we know how good it is for everyone. All the staff is getting health checkup done. All the staff is getting vaccination. So they are quite safe. Needle-stick injuries are nominal, you can say just 0.1%. So things are improving drastically. My hospital become bed-sore-free hospital. How? Because we are following all those guidelines which are written in chapters, care of patient COP, that is very important for patients, as well as ROM, because ROM belongs to me, so I am also going to each and every corner of my hospital and taking facility rounds. So with this, I know where things are not going well, so I can take action then and there, and it is very helpful for everybody, not only for me, for those who are working in that areas. Like, I really appreciate, sometime nobody was even aware that somebody who is working in gas manifold, that person can get some injury in ear. So we are providing them now all the equipments, whatever is required, like electricians. They are also safe because we are following all the norms. So patient is the most beneficiary for with NABH, but same time all the staff as well as the management, because we are already spending what the in form of salaries, in form of all the facilities, but we were not even aware about all the utilization rate, infection rate. So because of this HIC meeting continuously going on, so I am fully aware about what is happening in my hospital, who is working, which area is not working. Even if you talk about biomedical waste, which was a challenge before NABH, nobody was even aware how to dispose of. So all hospitals were following according to their wish. But now there is a guideline everybody has to follow. So we are taking trainings, and everybody is aware ki where to put biomedical waste, like glass things, where it will go, where syringes will go, how we are going to dispose of everything. So all these things are providing lots of good things to all who are end users as well as end receivers. I am talking about patients, because we are following international patient safety goals. Basically, NABH is all about patient safety. And according to me, if you really wish to run a successful hospital, one thing is required: your patient safety and patient satisfaction. When we are able to provide right medicine, right, at the time of OT, there is a checklist, and we are following, and every hospital who is taking accreditation from NABH, they are also following this. So my wish that every hospital, every healthcare facility has to go for NABH. Because there are lots of choices are also available, entry level, then is for small hospitals. So if somebody who is running a small facility, he can also go with there are very simple guidelines to follow. So I was so passionate about this accreditation board. Like I started hand holding of all small hospitals nearby. And now you can see all hospitals who are running near Yashoda, they all are accredited, because I believe if you really want to grow, if you really want to do good things, your neighbor also has to know all good things, because a lone person cannot do. So now we are promoting our Trans-Indian area as a quality healthcare service providers. Not only me, others are also. So these are the things, and we need to spread this news continuously to each and everyone who is related to healthcare. If they are working in healthcare, or they are going to take some medication or some consultation or any kind of help they want to go from a hospital, they should see this logo of NABH. And I am continuously telling to this thing, that kindly go to a hospital. Like, lots of people are asking me if they cannot come to my place and they are into some other city. I am telling them, if you are looking for a good hospital, go for NABH accredited hospital. Reason behind this, when we are going to take our treatment from a accredited hospital and there is a logo of NABH, you can understand that that hospital is following all the norms, international norms, because NABH is not less than any other accreditation in the whole world, because NABH standards are very, very good and they are covering all the areas. That is why ISCO accredited is NABH also ISCO accredited, and ISCO is the most important and only accreditation body who is providing accreditation to all accreditation bodies like JCI or JACO or any other thing. So according to me, for general public awareness, they should understand what is the difference between NABH and non-NABH. NABH means you will get a safe patient care, your patient will be safe and he is in a safe hands. So these are the things, and I would like to tell you a story that I was called by St. Xavier School and Merrill Company. They organize a talk for all standalone hospital, as Yashoda is also family driven hospital. So they invited all small hospitals who are running by doctors or some entrepreneurs. So they asked me, I was talking about NABH and all the benefits of NABH. So few owners asked me this question, Madam, you are talking about all the benefits of NABH, but don't you think and don't you see that lots of paperwork is required for that? Then I told them, as a owner or as a management person, what you want from your employee or what you want from somebody who is working under you, that he has to report you right things. Like patient fall, why it happened, and it should not happen in your facility next time. So there has to be some root cause analysis, there has to be some preventive action. So how you will came to know? You will never know what happened and it will happen again. So NABH will help you to save your patient, and that is going to add a feather in your hospital or your facility, because your patient will be happy and your patient will be satisfied. I believe it has to be compulsory because India is a very big country as well as very diverse country. And Ayushman Bharat Yojana is very important for everyone. So lots of people are now covered under this scheme. So I really wish that every hospital who is providing this Ayushman Bharat Yojana, they should also go for accreditation, and they should also follow all the norms. So everybody from the last to first one, everybody has to get safe patient care. So when we talk about homegrown standard, means NABH standards, so it was actually built with so much hard work, because who were involved, who were there in initiation, all of those people were really very learned, and they have done a great job. So we are focusing more on processes, so anybody can go for NABH. It is not important that how big your facility is. It is more important how you are doing a procedure. You are focusing on your SOPs. So we need to, we are supposed to, as India is not a very rich country, so every hospital cannot afford lots of money and lots of changes in infrastructure. So NABH is actually improving you within your existing facility with some modification as well as some your process improvement. So you are getting same result without spending lots of and huge money. So this is the basic difference between if I talk about other accreditations which are existing in different countries. But NABH is also an international standard, because we are providing accreditation to other countries also, and everybody who has adopted this, they are perfectly fine and happy, and if they are comparing with two accreditation, if they are having one more already, they are having some their own country accreditation, and now they have adopted us. So even Dubai is following our guidelines. I am also board member of Dubai accreditation board. So they are also even involving us, and as you can say that all those countries who are doing very well and they want to improve their patient safety, they are now coming to us and they are adopting NABH. So basic, if you ask me what is the difference between Western accreditation and NABH, so we are improving within your existing facility, just to modification with something and improving your processes and getting same results, patient safety. Because I work with Service Export Promotion Council and I am heading medical tourism. So these companies are also accredited now. We want that every company has to be accredited. So when foreign patients are coming to India, they should not get cheated in India. So how it will happen? When they will reach to a right place, a right facility. So for this we need to accredit all the healthcare facility as well as all the providers. So when everybody will be following some guidelines, so there will be hardly any hassle and everybody will reach to a right place and right destination. I believe that India is the best place for medical tourism because we are the one who is providing holistic healing. Not only modern medicine, we are providing Ayush, we are providing Ayurveda, we are providing yoga. Different things are available in India, Unani, homeopathy. So this is the main place where our Prime Minister also want that treat in India. So I really wish that India is going to be biggest hub for medical tourism because we have the best doctors, we have the best facilities, all cutting edge technology, and when we will work with the NABH, then it is going to be the best place for everybody from all over the world. And because we believe in Vasudhaiva Kutumbakam, so when somebody is coming as a patient, we don't treat just as a patient, we treat that person as our guest. So I believe that within 2 years we are going to cross all other countries and India will be the best place for medical tourism.